This module is to teach you about the 4 main players of the inner core. Start lying on your back. And the first main player is the pelvic floor. The pelvic floor sits below all of the internal organs, sort of like a basket. When the pelvic floor is not engaged, it's here, and it's sort of long fibers. And then as the pelvic floor becomes engaged, things sort of cinch up and contract. In order to initiate your pelvic floor, you can think about stopping the flow of urine in midstream. So just sort of relaxing, holding that in, and that contracts the pelvic floor. For men, you can think about sitting on a block of ice and how everything kind of contracts and draws up. And that is pelvic floor contraction. And the second main player, take your fingertips and palpate your hip bones. And then there's this squishy part right in between here. And when you cough, that part gets contracted. We call this the B line. This is your transverse abdominis. So try making a co-contraction from your pelvic floor first, releasing and stopping the flow of urine, and then contracting the B line as if you were coughing, pulling that line of skin taut. And then you have a co-contraction of the first two of the 4 main players of the core. Next, you have your external obliques along the outsides of your abs. So here, to contract your external obliques, you can think about knitting your ribs towards your pubic bone. So it's a very subtle movement. If I was to exaggerate it, it would look like this. But I want to avoid rounding the lower back. I want to maintain a neutral spine as I do this, and also a neutral pelvis. So, in order of operations, first contract the pelvic floor doing the Kegel. Secondly, contract the B line as if doing a cough. Thirdly, contract the external obliques along the outside of the abs. You can think of this as, if you were to place your hands on the outside of your waist, how can you inflate that area at about 60 to 70% of contraction, increasing the intra-abdominal pressure, but not so much that you're bracing down. And then the fourth main player of the core is your lower back extensors. So to call upon those muscles, you can think about how it would feel if you're sitting up straight in a chair. And a good way to test that is just palpating to see if the lower back extensors are turned on. So relax everything, and then you can start one by one. First, pelvic floor contraction. Secondly, the B line. Thirdly, external obliques, knitting the ribs, the bottom floating ribs down towards the hip bones, maintaining a neutral spine. And fourth, activating your lower back muscles. Once you've completed all 4 of those contractions, come to your tiptoes, and you can rest here, maintaining breath flow in through the nose and out through the mouth. And here my core is active. All those 4 main players of inner core are completely engaged. Then slowly lift one leg to tabletop with control, and lift the other leg. This is alternating toe taps, the easiest variation for targeting inner core. You can aim for about 5 to 10 repetitions on each side. One thing to look out for is bracing breath. Oftentimes you'll go into what's called sealing the glottis, and then there's no air escaping in and out through the esophagus, and you want to avoid that at all costs. Instead, do simple nasal and mouth breathing. In through the nose, out through the mouth, as you continue your repetitions. Take a brief rest, set the feet down. The next level of difficulty is starting with the feet in tabletop and doing your toe taps from there. So again, engage pelvic floor, engage the B line, engage external obliques, creating that intra-abdominal pressure at about 60 to 70%. Engage your lower back as if you're sitting up in a chair. Come to your tiptoes, bring the feet to tabletop one at a time, maintaining core contraction. Slowly lower down, tapping the foot on the floor. Notice the angle at the knee. Keep a fixed angle at the knee joint versus bending and tapping. You want to take the entire limb down so that your core is using your leg as resistance. Aim for anywhere between 5 and 10 repetitions per side, depending on your inner core endurance. If you're just starting out, start with the 5 and take a brief rest. And this is challenging for me. I'm definitely doing work here to maintain this active hollow body position. But I'm not overstressing it, or I'm able to talk and maintain breath flow the whole time. Once you finish, bring the feet down one at a time. take a rest, let everything relax. And then we'll go to the next progression. Engage pelvic floor, engage V-line, transverse abdominis, engage external obliques, and turn on your extensors in your lower back. Come to your tiptoes, bring the feet to tabletop one at a time. From here, peel the shoulder blades up, straighten out the arms, pump the arms, lengthen through the crown of head. This is Pilates 100. It's great for toning the inner core. Make sure that you avoid doing a full crunch. You want to make sure that the belly does not mountain up here. If you start to see it going up, that's an indication you might need to regress to the previous exercise. Lengthen through the crown of head as much as you can. The tendency is going to be to want to round the neck forward. Try looking up towards the ceiling. The more you straighten your legs, the harder this becomes. And maintain hollow body in the upper back and torso. Slowly come down and rest. Final variation in the lying position. Engage all four main players of the core. Eventually you'll start to be able to turn them all on all at once. And then from here, anchor your left leg down, so down from the femur, and then slowly let the leg drift off, the opposite leg drift off to the side, maintaining core contraction the whole time. You can palpate if you need to. Just alternate legs. If you wanted to make this harder, you can increase the length of the lever leg, straightening out the legs, internally rotating to call upon the inner and lower core muscles, and then slowly take the leg out to the side, resisting with core, and then off to the other side. Another variation is to do both legs at the same time, again keeping all four main players of the core active. You can do this with a short lever arm or a long lever arm. This is supine leg abduction. And go ahead and rest. Flip over onto your stomach for forearm plank. Begin with the elbows directly under the shoulders. And the order of operations is important here. So start by first engaging pelvic floor, then initiating a pelvic scoop. So your pubic bone will draw towards your navel and no lift happens here, and you want to avoid squeezing or clenching the glutes. So from here, turn on your lats, imagine you're windshield wipering the hands out, slowly start to lift your belly off the floor, then soften between your shoulder blades and lift from your lower back. And you'll notice I'm shaking a little bit here, which means I'm reaching my neural edge. I'm creating a change in my nervous system, recruiting my external obliques as much as possible here. And slowly come down and take a brief rest. You can aim for 3 to 5 repetitions from the kneeling position and eventually build up to the toes curled under version. So I'll demo one more time the kneeling version. Scoop the pubic bone forward, slowly peel the hips off the floor, keeping a nice flat back. Soften between the upper back and shoulders, lift from your lumbar spine. Lastly, curl the toes under, maintain long spine, firing the lats with a shoulder pack, scooping the pubic bone forward, releasing the buttocks, breathing in through the nose and out through the mouth. When you finish, aim for about a 30-second hold, testing your endurance. Take a Sphinx pose to stretch and release. Next, come onto hands and knees for spinal balance. This is different than traditional spinal balance in that there's going to be more attention focused to the inner core musculature. It's easy to just lift an arm and leg, but instead we want to fully engage the inner core and use the arm and leg as resistance for the inner core musculature. So calling upon the pelvic floor muscles, doing that Kegel, calling upon the B-line, the transverse abdominis, I'm doing all that here. Calling upon my external obliques, I'm knitting my ribs down towards my hips. Calling upon my lower back extensors, they should be taut to the touch. And from here, straighten the leg, the right leg back, flex the foot and internally rotate. Find shoulder pack, find true core engagement. And once you're here, extend the left arm, pull the pit of the belly in, lengthen through the crown of head and hold for several breaths here, maintaining breath flow in through nose and out through mouth. Slowly lower with control. Again, turn on all the 4 main players of the core. Stretch the left leg back, flex the foot, full engagement here, heel at hip height. Everything on in the inner core. Reach and extend, the palm is turned in here, lengthen through the crown of head, and breathe. Slowly lower down. Aim for about 5 to 10 repetitions on each side. This is a really great core routine if you're looking to strengthen your inner core and build endurance there. Also, if you're healing from previous injuries, low back issues, back pain, hernia, and other areas that are usually stemming from a weak inner core. I hope you find these useful. Please contact me if you have any questions, and enjoy. Namaste.